Hospitals are already facing staffing shortages. They're also facing drug shortages, including 2 drugs used for chemotherapy. That's forcing doctors to adjust or delay care for cancer patients. Nadine Abusada has the story.
It is a haven for people who have been touched by cancer.
A cancer diagnosis is something no one wants to receive.
The hospital saved my life. The gathering place saved my soul. Wow. That is what we're all about.
At the gathering place, they help ease that pain that the CEO, Michelle Serenian, knows all too well.
When my daughter, who was 4 years old at the time, was diagnosed with a very rare form of cancer,
her daughter was given a 20% chance to live, but thanks to the doctors at Rainbow Babies and Children's Hospital, along with the treatments she received, here she is, more than 20 years later, cancer-free.
And thank goodness that all of the different treatments are available.
But a shortage across the U.S. in the drugs carboplatin and cisplatin has caused many problems for patients receiving chemo treatment.
We are currently aggressively monitoring cisplatin, carboplatin, 5-fluorouracil, and methotrexate.
Patricia Roberts, the director for pharmacy and oncology services at University Hospitals, tells News 5 they are dealing with some of those same shortages. According to the National Comprehensive Cancer Network, a survey shows of the 27 largest cancer centers across the country, 93% have reported a shortage in the chemotherapy drugs carboplatin, and 70% reported a shortage in the drug cisplatin. At UH, they say they are getting what they can.
We aggressively manage through all of the vendors that we have the ability to procure any amount of these medications.
But in some cases, when the drug is not available, they evaluate what they have left, then discuss possibly changing patients' care.
Whether we can use alternative agents, lower doses, change regimens.
Which is something Michelle can't even fathom.
Cancer itself is frightening, but then to potentially be faced with the fact that you may not have access to the drugs you need is even more frightening.
So, as they relieve the stress on those cancer patients along with their loved ones, they are also prepared for the added burden this shortage could bring.
You hear some of these tough stories, but you see people being resilient and having hope.
Reporting in Beechwood, Nadine Abusada, News 5.